Hey, everybody. I hope you're all doing well. Welcome to our webinar today. We're going to let people funnel in here for a few minutes and then we'll get started, but excited to see some people jumping in. Thank you so much for being here. To kick things off, Matt and I are in Northeast Ohio, Canton, Ohio to be exact. And we're going to be using the chat function today along with the Q&A function. So if you wouldn't mind in your Zoom windows, finding the chat function and just letting everybody know where you're dialing in from, or where you're joining from, so that you can be aware of that function as well as just sort of see where everybody's from. Because we are going to ask some questions and would love to see some lively chat happening as we present some of this data today. So if you guys could do that, we'd love to see where everybody's jumping in from across the country. While we do that, we'll wait for a few more people to jump in here, and then we'll get started. Would love to know who everybody's rooting for in the Super Bowl as well. So if you want to throw that in the chat, you're more than welcome. Okay. I'm going to share my screen. And we are going to get going. Excited to have you guys here today. All right, everybody. Well, like I said, welcome to the webinar. Super excited to have everybody here. Like I said, if you'd like to use the chat, go for it. If you'd like to ask a question, you can go for that as well. Either way is a good way to communicate. So happy to use those two tools. Otherwise, we're going to go through a bunch of data today. And really the goal is for you guys to be able to understand some opportunities in the market to expand your business. So what this is really for, this webinar is for recruiting and staffing leaders that are looking to expand their business from a contract staffing, temporary staffing perspective into a new market that they're not necessarily in yet. So that's what this webinar is for. And the people that should be really finding a lot of value from this webinar are those that are in that position, okay? Side note, I am getting some feedback that the chat is disabled. Now, we tested that beforehand, so I am not sure why that's not working. Let's try that again. Okay, I just changed the settings, so you should be able to chat now.
There we go.
Okay, cool. We're good. Thanks, Kelly. Kelly Duke let me know that, so thank you, Kelly. Appreciate you. Okay, so let's keep it going. Like I said, we're going over top industries to target in 2024, and by all means, this is not an exhaustive list. So if you say, hey, this is not like one of the markets that I was considering, or I don't really see my little sub niche in there, that's by design. We can't go over every single market that exists, but we went over some of the main ones that we're aware of, that we support, and that we see data for in the staffing market. And those four industries that are the most common and sort of the highest level, right? There's sub niches that we'll talk about in these four areas are IT, healthcare, clerical, and education. Okay, those are the four that we're considering for expansion in this exercise. All right, there are some markets we're not talking about. There are certainly ones that you probably would be like, why aren't we talking about manufacturing? Not a market that we foresee a lot of expansion opportunity in from our perspective. Certainly could be wrong there, but there's markets we're just not covering. So if those are not the markets you want to talk about, I apologize. These are the four we're talking about. These are the four we're considering in this exercise if you're looking to expand. So IT, so software engineers, IT professionals, anybody in that position, that's sort of like IT. Healthcare, we're going to talk about clinical and non-clinical, allied professionals as well. So bedside, non-bedside, those sort of are all encompassed in the healthcare area. Clerical is anything that's not IT, but in an office setting, right? So HR folks, marketing folks, people that are data entry people, anything clerical, non-IT office positions would be considered in that area. And then education. So people working in K through 12 or higher education positions, those are what's covered under the education market in this exercise. So the goal is just to review those 4 markets, understand the pros and cons of each. In the case that you're looking to expand your business, if you're looking to open up a new market for yourself. So let's start with IT. IT has a market size according to a few different sources, but Staffing Industry Analysts, so SIA, gave this a market size of $86 billion. So pretty big market. Once you see the other markets, you're going to sort of understand the differences in the scale of that. But it's a large market, absolutely. A lot of contract staffing work available in this market. There's limited regulation comparative to the other markets in this space. So the complexity here is a little bit lower than some of the other markets we're going to talk about. But conversely, given that, there's high competition. Okay, so people recognize that this is a space that has low regulation, lower complexity, and therefore a lot of people target IT. All right. So to speak to that a little bit, we got some quick stats from SIA and some other sources here. SIA does release a fastest staffing firms list every single year. This year, about 74 of the 158 firms on that list came from the IT market. So a lot of the fastest growing firms, many firms that is, are entered and growing in the IT staffing market. So just to corroborate, hey, there's a lot of competition. There's a lot of competition. So I guess I would ask you, Matt, as our director of sales here at Foxhire, how many of the firms that we work with, I would say percentage-wise, might talk to you about IT roles?
I'd say right now, probably 30%, somewhere around there. So it's maybe not as high as this number, but we do have a lot of people who still staff in that area.
Right. And would you say that you're seeing, to speak to that second bullet point, median revenue growth, sort of flat, according to SIA, right? So this market isn't growing, it's not shrinking, it's sort of just flat. And in a recession market, people are saying it is, or it's not a recession. Are you seeing, from your perspective in your conversations, that number is right? Or would you say there's declining or growing opportunities?
No, I think that feels right based on the discussions that we have with recruiters and who are working in the IT field. That actually feels pretty accurate.
Okay, cool. No, I appreciate that. So I think what stood out to me, though, and then all of this information is that SAA's difficulty rating. So they offer a difficulty rating as far as how difficult is it to recruit in this market, right? And 2.96 was their metric. I think it's out of 5. But that was actually the lowest recruitment difficulty of any of the other markets, which is interesting. So I'd love to see in the chat if you guys would agree with that. Is it easier to recruit in IT if you're in the IT market? Is it hard? Is it difficult to find candidates in that market? And, I think part of that might be this layoffs number. There's maybe more talent out there. Not just from an internal perspective, these layoff numbers are for internal staff of recruiting agencies. So 36% of IT staffing firms are reporting layoffs, which I think is really interesting. So, the ones that are in the market, they are reducing staff. So something to think about. But in general, I think the difficulty level to find talent might be a really good indicator of how much opportunity is out there. So it could be a double-edged sword, easy to find people because there's not that many jobs. Something to consider, but hopefully you're sort of finding this information helpful if you're looking to expand into IT. So that's the market data. The next question we considered was, well, how difficult is it? What's the complexity in IT staffing? And like we talked about a couple slides ago, relative to the other markets we're considering, it's a little bit lower. The employment law, so that second bullet point we'll talk about, is just not as hefty in the IT market. Right? Obviously, there's regular employment law, all the normal stuff that would apply from an HR perspective in the United States, but there's not extra, more difficult things on top of that might apply in, let's say, healthcare or education as an example. Workers' comp is less expensive for IT roles. Most of them are remote. Those types of things make this a little bit easier of a market from a complexity perspective. But there are some specific things that I think we can talk about with IT staffing that you might want to consider. First and foremost is MSP and VMS involvement. If you're not familiar with those terms, MSP stands for managed service provider, and VMS stands for vendor management system. There is a heavy amount of usage of MSP and VMS vendors, and those vendors typically help buyers of staffing services go through the procurement process, whether it's through technology or with humans or both. They essentially centralize all of the vendors of staffing services for that client into a software system or through a process. And you might be familiar with some of those vendors if I were to name some, like SAP Fieldglass or Beeline or Artec. These are companies that you might engage with as you're selling staffing services and specifically IT. And so that MSP VMS involvement does create some level of complexity, but I would argue that it's less complex and there's less market share of MSP VMS involvement in the IT area than it would be for healthcare as an example, right? But you still need to be aware that that might be something to face. And it does create more complex processes because they make you do things their way. And that's why I added it into the complexity area. So Matt, of the IT deals that we're doing on our side of the house, how many do you think engage with MSP and VMS vendors?
I would say maybe 25%. It's certainly not, as you'll get into with healthcare, that seems to be much more prevalent in the healthcare field. I think with IT, thankfully, it's not quite as involved because there is some complexity there. Obviously, you lose a little bit. Yeah, of course, they have to get paid, which takes away from profit as well. So thankfully, it's not quite as bad as healthcare, but it's definitely there.
Yeah, absolutely. And again, we're speaking about these MSP, VMS vendors and all of this stuff from the lens of a recruiting or staffing agency. So when we talk about difficulty, these tools and solutions may be found to be very helpful on the buyer side, but we're really speaking about it from a recruiter side. And if you do start selling IT staffing services, you're going to find that engaging with one MSP or VMS is something to learn a process for, nevertheless 3 or 4, depending upon how many clients you have. And so it is something to consider if you're not currently selling in a market that has a lot of that MSP, VMS involvement. And we'll expand upon that later, especially when we get into the healthcare side. But the other side is immigration, specifically H-1B visa. So in the IT space, there's a lot more H-1B visa requests, at least that we've seen anecdotally, and something to consider if you want to start selling in this market. The immigration support services that you might need to offer if you want to get specific candidates into the market would be something to consider if you're wanting to maybe pull from other countries into the US. Now, with remote work and some of the EORs that have global capabilities, it hasn't been as strong as it used to be because you can still work from other countries for a US company now. But I would say just something to consider that those are the 2 complexities that we find in the IT staffing market specifically. So if you say, hey, Colin, like IT staffing is great, but I need to get more specific. What are some sub-markets or roles that you might be able to see that you've seen success with? And there's 2 that I would highlight. Again, not an exhaustive list, but these are sub-markets that I would say you could focus on in order to kickstart your staffing business in the IT market. 2 specifically. One I'm going to talk about is implementation. So implementation professionals are people that help companies implement new solutions. So if your client, as an example, were to purchase another software package that they need to roll out to their entire company, let's just call it Oracle or Microsoft Dynamics or AWS, anything like that, there are people specifically brought in on a contract or contingent basis to help clients do that. And it's a really great opportunity to sell contract staffing because it's project-based, it has a fixed term, and it's very high leverage, meaning it's very important to the company, right? Lots of dollars are at stake for the investment of that software, so they are willing to pay high bill rates to get people in there to help make sure the implementation goes well. So that's one I would highlight as a really good opportunity for contract staffing is those implementation professionals. And there's tons of sub niches within that specific to technology vendors. So, I mentioned Oracle, Microsoft, AWS. There's even in healthcare, Epic, Cerner, like all the different software players have this implementation requirement. So great opportunity to start just to find a niche in that implementation area. Second would just be traditional, old faithful software engineers. The need for software engineers is not going to go away. everybody wants top talent. And with your ability to hire from anywhere now, you can pull from a much larger pool of candidates. So it really creates a good opportunity to find candidates to fill needs for your clients that need software engineers. So definitely don't overlook that sub niche. I mean, there's all different types of engineers, which I know, Dave, you're commenting in the chat. I'm sure you could rip off all those different software engineer types, and coding languages and all that type of stuff. But I think just pointing you in those two directions would be really interesting to start with. So let's move to the next one. So we talked about IT. So you say, hey, Colin, like I already do IT. I'm looking for a new market. Okay, here's another one, healthcare. Healthcare is another large market, 68.7 billion, 2022, according to SIA. We saw a massive increase in the healthcare market, obviously, along with everything else in healthcare due to COVID-19. So that sort of really changed the market for staffing services in healthcare, which we'll talk about. But it's still a big market, still absolutely a big market, big need there. There's a number of things pushing that down, pushing that to fruition, like the aging population, reduction in the people that can take care of the older population. All of that type of stuff is creating this massive need for healthcare workers, the shortage of nurses, all of those things. So the market's not going away. So it's big, but there's complexity, much higher complexity in the healthcare market than compared to probably any other market outside of education. I would say from a complexity perspective, it's healthcare, education, everybody else. And there's good reason for that. People's health is on the line. There's all these different checks and balances. We need to make sure that people are properly licensed, all of those things. But in general, if you were to ask, is this a complex industry to do contract staffing in? Absolutely. Additionally, it's also, because of the market size and because of COVID-19 driving interest into the market, highly competitive. So massive need, massive interest. People see that some of the largest healthcare staffing largest staffing firms are in healthcare. So I think 76 were in IT and 78 offered healthcare. So, almost the entire list either offers healthcare or IT staffing. So that's an indicator that there's opportunity out there, right? Of the 158, they either offer IT or healthcare or both, right? Because obviously there's some overlap there. So good to know, right? Some of the firms that are being successful, growing really, really fast, are in healthcare. However, the median revenue is declining in this area. So if you look over here to your right in the table here, you can see, 2021, 2022, 2023. Obviously, with COVID, it went up 15%, 50%, 190%, 2021. That was peak. Still grew a little bit, 52% in 2022, but really took a nosedive in 23. About 30%, at least for travel nursing specifically, and see similar numbers across the board for all the different types of jobs. The only one that is maintained is locum tenens. Locum tenens are just physicians, right? People that are doctors, CRNAs, really anybody that can write a script or perform surgery. That's like a doctor. What you would consider locum. So those have remained consistent, which is interesting, comparative to the other support roles. But in general, like this market is declining. But over like a 10 to 15 year stretch, it has been growing. So not to be dismayed, I think there's still lots of opportunity there, but it is declining as of right now. So I guess I would ask, I know there's some healthcare recruiters in here because I see Diane. Would you say, any of the healthcare recruiters in the chat, that you're seeing a decline in orders or an increase in orders right now? Like, is it consistent with this data that we're seeing from SIA, or is it not? I would love to hear anybody in the chat sort of go through that question and answer. As you guys do that, we'll love to see some chat going on, but otherwise, 38% of firms are reporting layoffs in this market. So that's internal staff. So people that have recruiters on their staff, definitely seeing those people being laid off, more so in healthcare than any other. So of the 38% that are reporting layoffs, 20% of them are reporting greater than 10% cuts. So much bigger cuts in the healthcare space, meaning, they're sort of following along with this big decline from 190% to negative 30%, over hiring, all of that type of stuff. So people are really paring down, trying to focus in and being more lean, but it's not to say that there's not opportunity. And then I would say lastly, compared to IT, which I think had 2.96, SIA recruiting difficulty is at 3.3, which I don't believe was the highest, but it was a little bit higher than the others. So they're all right in there, about 2.9 to 3.5, but this one was a little bit higher. So certainly, I think with the nursing shortage and all of the burnout that was associated with the COVID-19 pandemic, it's a little bit harder to find candidates right now. And they have a lot more options. So you got the gig platforms, you've got normal traditional staffing. People are going back to full-time roles now and not doing as much traveling. All of that stuff is creating a little bit more difficulty to recruit. But definitely lots of opportunity still. 78 of the 158 are growing faster than any other firms in the country. So let's talk about complexity though. And this is where you have to be really, really prepared if you wanted to expand into healthcare, okay? The top complexity item, in my opinion, which sort of is a flow down of everything else below that, is the MSP VMS involvement. About 51% of healthcare buyers carry an MSP. And more than that, I think 70% plus use some type of vendor management system. And those vendors that become middlemen between you and your buyer create tons of processes for you to follow and also increase your competition, right? So what I would say is if you're considering healthcare, be wary of the idea that you're going to get into some MSP and get a ton of job orders and just crush it. Be very wary of that, okay? And there's multiple reasons for that, but that's the mindset we get with a lot of healthcare recruiters when they first come to us, at least, is, I want to get into, let's just say AMN or right sourcing or, whatever MSP that they're focused on. And don't get me wrong, those are great companies. We partner with those companies. We do business with those companies, tons of clients that they support, no doubt. However, the idea that those job orders are just for the taking and that nobody's filling them, so I'm going to come in and do all of that, is very misguided. So as Diane would say in one of her comments, more competitive than ever, right? So everybody is chasing those same job orders, okay? And when you don't have access to your client directly because the MSP or VMS is in the middle, it makes it very difficult to really hone in on your process and make your submission of candidates stick. So you could really spin your wheels quickly and not get any return on your investment if you're not being very focused on execution of the recruitment process and engagement. And so I would just say be very careful of that idea. Those MSPs and VMSs can be distractions in some cases. And if you are doing business and you're getting candidates onboarded, that's great. But then obviously the complexity comes in with their processes and everything below that on the list that I'm showing you. Specifically, employment law and healthcare regulation. So let's talk about a couple of those things. And again, this is aimed at people looking to get into healthcare for the first time. So if you're the healthcare recruiter, you might know this stuff. But as far as employment law is concerned, there's all the regular employment law stuff that you might, think about in your mind, right? Like equal opportunity employer, overtime laws, double time laws, right? Like all of that stuff. Sure, that's without question. But then there's the extra stuff for healthcare, like license verification, drug screens, background checks, immunizations, titers, all of the things that go along with getting somebody from I'm interested to starting to work, right? And I was like, my Zoom keeps doing this. I don't know why. If somebody can teach me not to do that, I would love that, but I just keep getting fireworks, so we'll just roll with it. But that idea of getting somebody from interested to starting is a lot different in healthcare than almost any other position because of all that onboarding stuff that needs to happen, which is required by law. Second is healthcare regulation. There's new regulation coming in response to COVID-19 that is changing the healthcare staffing market, and it has a lot to do with licensing. So prior to COVID-19, there was maybe 1 or 2 states that required staffing firms to have healthcare staffing licenses if they're going to offer healthcare staffing in those states. There's now 23 states that require a healthcare staffing license for staffing firms looking to provide contract or temporary staff in the healthcare market in those states. Now, Foxhire, we carry, I think 18 of the 23, and I'll have to check to make sure that's the exact number, but we carry quite a few of them. So, we're going through all of those processes. But if you're new to it and you don't know that, you can get into trouble by not getting licensed first. So be careful. I would say check out your state or the states that you're operating in. Make sure that you know how many licenses you're supposed to carry, or if you need to carry one at all in your state. And then on top of that, those licenses come with rules. So when you get licensed, there's a ton of reporting you have to do. You might have to send your contract to the state every time you get a new client. You might have to comply with bill rate caps, like New York, as an example, set those out. So just you got to look at your state specifically and understand, do I need to get licensed, and what are the rules that go along with that? So that's the majority of the complexity that goes along with healthcare, other than workers' comp. And so then we get into the workers' comp area, and workers' comp is a little bit more expensive in healthcare because there's higher risk. You know, obviously people are engaging with patients. They're in big facilities. You know, there's a bigger opportunity for somebody to get hurt on the job than compared to IT or clerical, as an example, because of their environment. So you got to build that into your pricing if you're going to be offering healthcare staffing, and ensure that you have a really good workers' comp carrier that understands healthcare staffing, if that's something you want to expand into. Or an EOR, we can help you too. So if you're like, okay, that doesn't scare me away, I'm still interested. I want to do healthcare staffing. These are the three submarkets that we're going to talk about. And the third one, I think I'll let Matt speak to, as far as like, what does niche markets mean? Because I think there's some interesting ideas there. But when people look at healthcare staffing, most people are thinking about travel nursing. That's the first thing that comes to mind, right? RNs, LPNs, CNAs, traveling to a place for 3, 6, 9 months. And a lot of that is through MSP providers. And so when you get into an MSP, you might identify, wow, there's a lot of travel contracts in here. Totally true. Definitely a market. If you recall from the previous data, though, it is declining, probably more than any other of the submarkets. That said, still a good market. So consider that if you're interested. If you feel like you could do well in the nursing area, I think that's a good option. The second is a little bit different but similar, is per diem. Okay, and per diem or shift-based healthcare staffing is more localized. So you get a pool of workers in your local area, and you send them out to shifts at different clients that need them on a day-by-day basis. So hence the name per diem. It's a little bit different than travel nursing, which is longer-term contracts. The per diem model is more localized, shift-based, and you're sort of managing where people go and when they go there. And there's a lot of technology that can support that, like scheduling apps and things of that nature. Not always as common to see MSPs in this market. And that's typically because this market is more selling to like long-term care and skilled nursing facilities. So like rehab facilities or long-term care facilities, rather than a hospital. And that the hospitals are more engaging in the travel nursing and things of that nature, less the per diem. That's not blanket, but in general, that's what we're seeing. So those are two interesting nursing markets that I would say explore if you're interested in healthcare staffing. And then the next is niche markets. Now, niche markets are roles that are supporting healthcare, a lot of times bedside, but not necessarily nurses or nurse type roles like RN, LPN, CNA, right? There's different types of technicians and support roles in these niche markets that you could consider expanding into, that we've seen people have a lot of success with here at Foxhire. So I guess, Matt, without sharing too much information, what are some of the job titles that you're familiar with in the healthcare market that we see that are less known across the recruiting landscape, but we see a lot of success with?
Some of the ones that we're currently working with, people in radiology, dosimetrists, leadership is a big one that has come up recently too, where we're actually working with more of the administration side of hospitals. Allied health is growing, schools. There are people, which I know we're going to get into schools later, but there are healthcare roles in schools that we're seeing a lot of success with as well.
Yep, absolutely. So some of the more non-traditional roles I would urge you guys to consider, because there's less competition there. And a lot of times these roles are so niche and can be sort of higher up on that org chart that it's higher bill rates. So you don't have to find as many to make as much revenue, right? So I would want you to think about travel nursing and per diem as sort of higher volume, lower margin business that you have to get a lot of repetitive business going. And then the niche markets are a little bit lower volume, higher margin business that you could be successful with maybe like 5 to 10 people on assignment. Whereas you probably need like 10, 20 people on assignment to get a large amount of revenue from these other per diem travel nursing opportunities. Physical occupational therapist, Dave. Yes, absolutely. I would save that for the education section. We'll talk about that later. But yes, OTs, PTs, speech language pathologists, all things we'll talk about. Those are all really good roles. So let's move to clerical. So clerical is probably the lowest barrier to entry of any of the markets, right? Like anybody that just sits in an office and do paperwork or data entry or anything like that, it's probably the easiest market just to start. Just say I'm going to offer these roles. Very low complexity from a regulatory perspective. High speed to finding candidates, getting in the job because there's not tons of onboarding, and it's a huge market, 264 billion. I think that's the biggest market we've talked about. Every company needs clerical people. So there's a large need, but there's high competition because of that. And price points are very low. It's very commoditized comparative to other markets. But doesn't mean you couldn't find success here if you're looking to expand your business and offer a new vertical. So some quick stats. 15 of the 158 fastest growing staffing firms offer clerical staffing. So obviously the market isn't growing as fast in this area as it might be for the other areas. So consider that as you're thinking about it. But this would include like finance, clerical, office, marketing folks, HR, anybody that's not IT but still works in an office, just as a reminder. The median revenue growth, like IT, is flat. So it's not growing, it's not shrinking, which I think is a good sign in this economy, like I said earlier. And the firms that are reporting layoffs, we couldn't get the exact number for clerical specifically from SIA, but the average was 38% across all industries. So I would just consider that might be the norm. SIA difficult rating as far as finding candidates, 3.09, so a little bit lower than the healthcare market that we just looked at, but not as good as IT. Pretty close though. So I would say it's probably not that difficult comparative to IT to find a candidate in this area. And like I said, complexity in clerical is not that high. If there's MSP VMS involvement, which I can tell you, you can probably find tons of clients that don't use VMS and MSP. And I would suspect that the ones that need help finding clerical folks are not the biggest companies in the world. They're going to be the small to mid-sized companies that don't have an employer brand, that need some support getting an HR person or a finance person into their business, because the bigger companies are going to have that brand recognition. And when they have a clerical opening, a lot of times there's a lot more interest from a candidate perspective until you get to the leadership roles. Additionally, those bigger companies are going to use MSPs and VMSs, so that makes things harder. So if you are going to look at the clerical side, the SMB businesses are really strong candidates for clients. I think that would be where I would focus. But then all the same things apply from an employment law perspective and workers classification perspective. 1099 versus W-2, I think might be your only concern here, especially in the finance arena. I would be, if you're going to go after accountants, we'll talk about that in a second, just making sure that you're classifying workers correctly, 1099 versus W-2. You might call that corp to corp. That is an increasing topic amongst the regulatory bodies, is whether or not staffing firms should be placing people as 1099s or W-2s across all industries. The light is really shined upon healthcare right now in that on that question. But in general, just you want to make sure you have your I's dotted, T's crossed from a classification perspective. But I'm only mentioning that because there's just not a lot of complexity here, comparative in the clerical area to any of the other areas. The only other thing I would highlight is that price maturity. So you just got to be prepared to be a little bit lower on price. I think the margins we see in like healthcare and IT could be like 55 to 75%, maybe higher. But that's an average, like 56% is the average we see at Foxhire. In clerical and like compared to manufacturing that has price maturity, you're looking at maybe like 40 to 50%. So just a little bit lower margins. Just make sure you're prepared for that if you're looking to offer those type of services. But one sub-market we wanted to highlight is the accounting market. And this is sort of an emerging shortage that people are I don't know that they're that aware of it. If you're in the accounting area, you do know about it, but there's just not enough accountants right now. There's actually a shortage, according to quite a few sources. These numbers come from our sister company, Patriot Software, which sells software to accountants and payroll software to accountants. So they're very keenly aware of this. Interesting, 75% of the CPA workforce reached retirement in 2020. So like all the accountants, almost all of them, 75%, reached the age of retirement a couple of years ago. So they're all phasing out, right? Additionally, on top of that, candidates are phasing out of the workforce. The supplement, the people that are supposed to be coming in, the amount of people that are actually getting CPA exam passed is down 17%. So you have this like double-sided marketplace that is losing people on both sides. So basically 300,000 US accountants and auditors left their jobs between that time period as well. So you're sort of having this huge gap in opportunity. And if you can find people and be a great recruiter and put them into a client's business, you're going to be very successful in that area. So I would say that's a good opportunity. That sub-market, if you're looking to expand clerically, very good opportunity there, I think, just because of the dynamics of the market.
Colin, can I just add something real quick to that?
Yeah, sure.
I think that's a great example. And there's that expression, the riches are in the niches. Some of the success that we see are people who do focus on one area. So whether it's accounting or legal or marketing or insurance, whatever it is, they seem to have more success because you're really focusing in on that one area and becoming an expert, getting the contacts, all of that. And they have much more success than the person who's putting a bookkeeper over here and then administrative assistant over here. And there's just, again, it goes back to you're going to be able to get higher margins as well. And so that's just, I just wanted to bring up that point.
Yeah, absolutely. I would totally tend to agree. I think there's some great examples of that even in the people that are attending this webinar. But yeah, if you were to focus on accountants as an example, we're aware of multiple firms that only do accountants, and they'll even sub niche down to like tax specifically, right? Like that's a very good example. So, but I would be very excited about the accounting market if I was looking to expand in a clerical area. Okay, lastly, so Dave, I'm coming back to you. Education. So education is the smallest market of the ones that we're evaluating right now, according to SIA. Now, I'm suspicious of this data, but this is what SIA says, 1.7 billion as far as the market size. I would tend to believe it's higher than that just because of the amount of school districts that are in the United States and the business that we do. I can almost guarantee that the market's bigger than that. Nevertheless, that's what they said, but it's growing quickly. So it's a really good opportunity, and there's some dynamics that we can talk about as to why it's growing quickly. We'll get to that, but it is complex. So because you have people that are working with children and potentially also in a healthcare position, those two things create a very highly regulated industry, right? Because you want to protect the kids, you want to make sure that people working in healthcare are, safe and qualified and all those things. So there's tons of regulation around those two areas that make it difficult to get somebody from I'm interested to in the job, right? And that's the main issue that you're going to face. But if you can overcome that complexity, lots of great opportunity. And that's why there's low competition. So there's low competition because of the complexity, because of the size of the market. So I think there's an opportunity here if you're really looking to expand, and if you had maybe some experience in an adjacent market like healthcare, this could be a really good opportunity. So some quick stats. None of the companies in the fastest growing staffing firms on the list said they were in education. Now, like we said, there's crossover between healthcare and education here because of the types of roles. So I wouldn't necessarily go all in and believe that, but just be aware, SA's list, none of the people were on that list. Now they had a separate report that outlined the healthcare staffing firms that they track, and of the market that they had, 1.7 billion, 71% of that market share is between 3 firms. So like from SIA's perspective, there's only 3 firms really executing in this market. Now we're aware of other ones that are obviously being successful, but to get on SIA's radar, it's only these 3. It's like Kelly Education and a couple others. So to me, that speaks, hey, this is an underserved market. There's only 3 firms really doing well here. If I had success in an adjacent market, I could really execute well. The median revenue growth in this area is 30% though. So, I mean, if you saw all the other markets, they're like down or flat, this one's up 30%, which I think is really interesting. Some of the things that are causing that are the increase in the amount of children that need support at school. Okay, so occupational therapists, speech language pathologists, physical therapists, all of those types of roles, the increase in the need for those is exponentially growing right now. Due to our population of children entering schools. And that's why you're seeing the 30% market growth for this area. If you were to follow the market really closely like we do, AMN is one of the biggest MSPs in healthcare, and one of their fastest growing markets, if you were to listen to their earnings call, is K through 12 school districts. Huge opportunity. I think we're going to continue to see that take place over the next, 5 to 15 years. So if you're looking to get into a market, this could be a really great one to get into. Again, the average firms reporting layoffs was 38%. I wouldn't apply that to the schools, but we're just trying to give consistent data here. Same goes for the difficulty rating. I would suspect it's a little bit more difficult to find candidates in this market than it would be clerical or IT, but I think it would be consistent with healthcare. So you want to think about it like you're recruiting for healthcare, a little bit more difficult than the other markets. Let's talk about complexity. It is complex. Good news, bad news. There is a growing amount of MSP and VMS involvement in the space, but for the most part, it's not a market that the MSPs and VMSs have penetrated very well. So the percentage of market share that they have in those areas is limited. I think a lot of that has to do with the fact that you have government buyers, so local school districts have not adopted the MSP VMS solutions, which greases the skids, in my opinion, compared to other buyers for your solutions, because you can still establish that direct client relationship, which I think is really important. Now, they still go through bidding processes because they're government entities, so that's a different level of complexity you have to follow. But in my opinion, I think that's you still have the benefit of your brand recognition and a relationship that's easier than MSP VMS. Then obviously all the general employment law stuff applies, but then there's industry specific education regulation. So I'll just give you an example. A new law that was passed in Illinois called Faith's Law makes things really difficult for staffing firms to comply with. Specifically, it basically requires staffing firms to track everywhere somebody's been and if they've ever had a problem with a student from like a sexual harassment standpoint. Like there's just one random law. Every state is different and has laws like this, but in general, there's more industry specific requirements for education workers than even, in my opinion, healthcare. So that applies to onboarding and all of the normal employment law stuff. You're going to have to work through a little bit more of that in education than you would even healthcare. So higher regulation and difficulty from a complexity perspective, but it's a trade-off. That's why I said good news, bad news. So lastly, I would just say, like SIA had, there's 3 incumbent vendors that sort of make up 71% of the market share. So you're going to be competing with these bigger players. You're going to have a differentiator. And that's where I think Matt's point about the riches are in the niches is absolutely true. These large education staffing firms provide a swath of types of roles to these education buyers. So if you can focus on one specific role, Dave, to your example, occupational therapist, maybe, I think you could really do well if you're expanding into that market for the first time. So a couple roles that I would highlight if you wanted to do that. Occupational health and speech language pathology. Those are the ones that we're seeing the highest need for due to the population of the students that are entering the school districts that need support while they're at school. So if you were looking to expand, I think these would be 2 roles that I would highlight for you. They're not the only ones, right? Like Matt, I think you said school nurses were also one that you could go focus on if you wanted to do healthcare in schools. But are there any other roles that you would highlight, Matt, that I haven't mentioned either in education?
Not really. I mean, I think these are the big ones that we hear of most of all.
Yeah. Okay. Cool. So yeah, and these ones are the biggest ones I think that I've seen as well. So if I were getting into education, I would probably focus here. So in general, we've looked at 4 different markets. Like I said, they're not the only markets, but there's some great opportunities out there if you wanted to expand. So I would say review the markets available to you and try to understand the data so that you're really prepared to offer a service prior to marketing that product, right? So all that complexity, all the things we talked about, you got to get those things figured out first before you can start saying, hey, I have candidates, right? If you're trying to do contract staffing, it's a little bit different from direct hire. So I understand that, but I'm just talking about contract staffing. That's important. So some of the things to consider if you're doing that. Regulation, right? So think about the regulation. What does the regulation look like in my state, in my industry, and specifically even the jobs that I want to offer? Who are my buyer personas, right? The last market we talked about, education, those are government buyers, totally different buyer persona than an HR manager at a large company looking for IT people. Like that's just a totally different process. So you really want to understand those buyer personas before you start marketing your services. Competition. If I'm going to go market my services in this market, who am I going to go up against, right? And what do the prices look like? You got to make sure you understand that. So when you get into those conversations, you can have those conversations well. And then lastly, what are the barriers to entry, right? MSP, VMS vendors could pose a risk, could be an opportunity. So understand what the barriers are before you decide, hey, like this is the market for me. Here's some data to review. And I would say consider the trajectory of your target market, right? You never want to get into a market that's going to end up going super far down. Now, I think right now the market's a little, I would say funky. Is it a recession? Is it not a recession? Healthcare specifically has just gone through a crazy up and down. So you want to really understand, like, is there a market that's growing for me specifically? And maybe it's not these higher level numbers, but even sub markets below that. Think about that before you enter the market. I've been using tons of SIA data today. If you're not part of SIA, great information. So if you want to go find some of this data, here's just some of it that I had. This is the most recent swath of data that they have. But yeah, I would highly consider that. Here's the data from us. So this is actually our coverage of the space. So what we're seeing from our business is sort of this breakout of types of business that we're covering. So 22% of our business is in healthcare, 32% in education. So those highly regulated industries are something that we face a lot. So we do support a lot of that. So if you have any questions about that regulation or the complexities in those markets, certainly would recommend reaching out to us. We'd be happy to talk you through some of those. But we also do a lot of the other markets, even ones we didn't talk about, like light industrial, IT, and business professional, which you would say is clerical, right? So we've got a pretty good wide range of types of jobs that we support, and happy to offer any other support that you didn't see in this webinar, just personally through a call or email with one of your reps, or happy to reach out to you directly as well. If you're like, well, what do you mean you cover stuff? Like, what is your business, right? So we're an employer of record. So the reason why we're talking about all this stuff is because we support clients like you guys. Our clients are recruiting and staffing agencies, and we become the legal W-2 employer of record for the temps or contractors that they put on assignment at any of their clients, okay? So all of that complexity around regulation and processes, that's all the stuff that we handle, right? Along with the payroll funding, we make it really easy with software, which you can sort of see here, to make using us and engaging with those services as simple as we can. We offer benefits to the candidates. We offer insurance like workers' comp. We handle the invoicing, and we have HR support. So if you're thinking, hey, like I would love to get into contract staffing, but that complexity and stuff like that really scared me away, we could be a great solution for you in a turnkey way where you can just start marketing those services, and we've got all the stuff in the background to back you up. Definitely not the only solution out there. Certainly plenty of staffing firms go do it themselves. But if that was of interest to you, I'd say definitely reach out to us. What we can help you do from a use case perspective, some of the use cases I would highlight, just offering contract staffing for the first time. If you've never done it, we're a great turnkey solution for that. Or if you're doing it now, but you want to expand into a new state or a new industry that's maybe more complex, that's a great opportunity. Have a lot of firms that just use this for like California or New York or Illinois as an example, because those are tougher states than maybe the state they operate in. We can also take on large volume opportunities. So if you say, hey, like we don't have enough payroll funding to get this client this massive project, but we'd love to still say yes to them. Can you support us with that? We do that as well. And we take on opportunities that are a little bit higher workers' comp risk than our clients want to take on. Or some of the bigger firms just come to us because they want to streamline their back office. So any of those things stand out to you, or you feel like they'd be good use cases for you, we'd be happy to support you. But in general, we just want our recruiting firms that we work with to grow. Hence why we're talking about expanding into new markets. So I hope that was helpful for you guys and you found some value in it. We've got about 10 minutes left. Happy to answer some questions. And I do see one that's in there from Dave. Are you seeing anything in logistics supply chain space? I would say yes. It's not as much as the other markets. There's definitely opportunity. However, I wouldn't say we see it as much as like healthcare or education or IT as an example. And Tan Nicholson asks, just to confirm, the agency doesn't need licensing because you're licensed in the state. That is correct. We are the agency that's licensed. So if we're the employer of record, the legal employer, we are going to be the one that needs to have the license. That is correct. Absolutely. So we carry licenses on behalf of all of our staffing firms in the healthcare space. And just to reiterate, I'm waiting for questions. So if anybody wants to ask more questions, would be happy to answer those if anybody else has anything else. We'll hang out in here for a second. Or we can just talk about the Super Bowl if anybody wants to let us know who they want to win the Super Bowl. I would love to see that. Like I said before. Dave, can Foxfire do anything in the restaurant industry? So I would say similar to manufacturing, Dave, it's a case-by-case basis. Our typical rules for us from a risk perspective is people handling cash or serving alcohol would probably be a no. So bartenders, probably not. Servers, I would say that we would need to get a job description to understand the environment. But it's not as blanket as like IT, clerical, healthcare as an example. We need more information than just an industry there. So if you had an opportunity there, I would urge you to work with your rep and get some job descriptions over to see if we could support it. But it's not one that I would say we do a lot with. Do your EOR support state contract for healthcare staffing? Yes. So we've done a lot of healthcare staffing with state entities. Most recently with the COVID-19 pandemic response, we did a lot of pop-up vaccination and testing sites through the state. So yes, we can support those. And again, I think we just need to see the contract, get with a rep to evaluate that opportunity. The previous chart you posted was based on how many contract employees or I'm missing what you're saying, Chris, there. Are you saying our business, like how many people? Do you do travel nurses? Yes, we do travel nurses. We do a lot of traveling healthcare roles in general. You know, it's not just nurses that travel. There's a lot of healthcare roles that travel. So, but yes, we do those. I'd have to get you an exact number, Chris, on how many people we had on assignment last year. Let me follow up with you on that one. I don't know the exact number, to be honest. Sorry about that. Anybody else? Dave, so yes, we have marketing documents, and that's a great question. So Dave Scro's question is, do you have any marketing documents, templates that we can use? Yes, we do. Dave, you can actually create co-branded marketing collateral in your Foxhire portal that has your logo, our logo, explains the EOR model and how it works. If it's under, I think, tools, right, Matt, on the left-hand sidebar of your Foxhire portal. So go there. If you want more than that, definitely reach out to your rep. And we have some other templates for things like conversion fees and things like that that could also be helpful. Anybody else? Okay. Well, thank you, everybody. Matt and I really appreciate your participation. Had a great chat as well. So thanks for jumping in the chat box. That was great. If I can help anybody, feel free to follow up with me directly. Otherwise, have a great rest of your day and good weekend. Thanks, everybody.